to the We Talk Health podcast, the official podcast of West Tennessee Healthcare. I'm your host, Kara Mobley, and on today's episode, we are discussing all things mental health awareness. Here with me are my guests, Donald Jordan, the clinical program manager, Kim Barber and Lindsey Wambles, who are clinicians with Pathways. Thank you all so much for being here today.
Thanks for having us.
Now, Donald, I know this is not your first time here, so welcome back. And how have you been?
Thank you. I've been
Since
great.
We've seen you, last we talked, it was during COVID, and we were just talking about all things Pathways and COVID and how mental health was back then.
Yes, it's nice to not be worried about wiping off microphones and how
3 years later,
how to do a podcast spread out. Yeah, it's nice to be back.
We've come through it. The state of emergency's over.
That's right.
Yep.
We grew a lot during COVID, and then that's just been going nonstop.
I feel like
then.
that's taught a lot of people a lot of differences about just how we run our day-to-day lives.
Absolutely. And it made mental health became a part of the conversation in a way that really I don't think it ever has before, to everybody's benefit. Really, I think the system's been incredibly supportive and paying a lot of attention to the importance of mental health. So, yeah, it's good to be back. Thanks for having us.
Thank you. Now, Kim and Lindsey, this is your first time here. Kim, why don't you tell me a little bit about yourself?
So I'm primarily in the Dyersburg area. I work with pregnant moms and new moms and children 0 to 5. And really, my focus is more attachment-based. I do a couple of different therapies. It's CPP, child parent psychotherapy, and Lindsey's also going to talk about parent-child interactive therapy. And we're really excited about these different types of techniques with working with families. I am in Union City on Pathways office on Mondays, Dyersburg Tuesdays and Wednesdays, and we are going to the Weekly County Head Start and the Brownsville Head Start on alternating Thursdays. And then I'm at the Psychiatry and Counseling at Thompson Farms on Fridays.
But when her daughter is in a play, she is out of there.
She is. I am.
She is. She always lingers and talks, but listen, when her daughter's going to be in the play, Kim's got to go.
That's right, because she's amazing. Yes.
There you go.
Great, yes. And how long have you been in this role?
So in this role, going on a year.
Great.
And Lindsey and I have covered a lot of territory in a year.
Right.
And so we've really, Dyersburg was like our pilot program, getting started with this, especially working with the really young children and developing the relationship at the Dyersburg Hospital with the OB department. And we get referrals from there, able to go in and meet the moms and develop those relationships. And then just helping to work with those families that are struggling with just day-to-day life and children that are having some behavioral issues.
Well, Kim, thank you so much. Now, Lindsey,
Thank you.
Tell me a little bit about yourself.
So I've been in this role working with this population with Kim, like she said, for about a year as well. I recently just graduated with my master's in social work this month. It was actually at the beginning of this month. Thank you. Very excited.
So both of y'all, we lucked out. Both Kim and Lindsey. I had Kim as a student in undergrad back in the day when she came back around to do social work. But then at Pathways, we'd lucked out having both of them employed with us in one role while working on their master's degrees at the same time. And so then they've been serving with Pathways in one capacity and then using the fact that they're getting internship hours and other stuff, kind of opening up some new territory for us. And it's nice now because with both of them, we've gotten to hire them in those roles that they started kind of practicing in when they were in school. They've officially stayed with us now and moved into those roles, which is exciting.
And there's a lot of variety of things that are happening within the department. So, Donald, how do these new programs that Kim and Lindsey are working on fit within the Pathways organization?
Sure. So Pathways, we've got 9 offices in 7 counties. And so like Kim mentioned, both of them cover multiple offices. They are
on the move.
They are burning the road up all the time. Everybody wants a little bit of their time. But one of the most exciting things is beyond them covering our Pathways office in Dyersburg and Pathways office in Union City, they also were there when we opened our very first office of a brand new service line with West Tennessee Healthcare, which is Psychiatry and Counseling. We found that Pathways is proud to do the work that we do with detox, inpatient, partnerships with criminal justice systems, schools, courts, across the board. But what we found over the last few years, especially post-COVID, a lot of people want just traditional counseling. They just want to go to a counseling office.
You may just feel like you need talk therapy, which is honestly, that's what I've had. I've had a therapist for the past 4 years who I absolutely love. And yeah, it's just talking it out. And
that's right.
Sometimes that's all you need.
That's right. And of course, we offer that as a part of what we offer at Pathways, but we realize that some folks, they're not in a crisis, so to speak. It's not a disaster. It's just, you know what? I think I'd like to talk to somebody about this. And so we've opened our very first psychiatry and counseling office, which is just that. So we don't handle crisis in that office. We don't have all the wraparound services there that we do at other Pathways. We can connect you to those if you need it, but it's just a traditional outpatient counseling therapy office. It's nice. We are thrilled to be neighbors with the primary care folks out at Thompson Farms. And they've got patients. They have walked somebody over almost every single day since we've been open in February.
February of 2023.
February of 2023. Yeah. We opened the very end of the month. And since people realize it's just an outpatient counseling office, it's not a lot of high crisis, high acuity stuff going on over there. Employees of the system through Living Well and just people who show up at the primary care office, something may come up in their doctor visit and they say, hey, West Tennessee Healthcare's got a counseling office next door. Would you like to go over there? And they say yes and come by. So it's in the context of that we've been able to, knowing that we have these programs, which I'll let them talk about, that really are new for us as a system in behavioral health. Therapy and Learning Center does all kinds of amazing stuff with occupational therapy and speech therapy and all those things. But as far as counseling, we haven't really had many tools in our tool belt until now.
Right.
And so with this new office opening, come by and visit us. You'll see part of the lobby is where most of the grown-ups want to hang out, toys everywhere, great mural on the wall. One of our staff did. And it's built for this. It's built for kids. It's built for programs like this, which is exciting to serve this new group.
Right. Now, where is that located? If anyone wants to visit there, or do they need to call, what would you...
It's at 1270 Union University Drive, and the number is 731-265-6450.
People can actually walk in right now. We're open Monday through Friday. I can't promise we can see you if you walk in, but so far we've been able to do that. That's important to us. When somebody decides it's time to talk to somebody, we want to take advantage of that time. Yeah. So it's on primary care, that building right on the corner in Thompson Farms.
Thompson Farms, right.
Primary care is on the left side of the building, kind of the left 2/3, and we're over there on the right side.
Just a little bit farther down in the same building, correct?
That's right.
Great.
So I will mention we applied for and received a grant a little over a year ago from the State of Tennessee Mental Health Substance Abuse Services Department, which really the whole goal of that grant was connecting behavioral health services to primary care, addressing issues with children and families across a host of areas. And it's given us the ability to be able to fund sending Kim and Lindsey and a host of other staff. We've hired tons of new staff, but it's given us the ability to send them for really specific training. There are some days where I just try to get super nosy over there because I want to see these like PCIT, the parent-child interaction, play therapy, child-parent psychotherapy. It's stuff I want to know how to do.
How important is that to people to have those resources, and how has it been for you guys? What has it meant to you? What have you noticed in the time that you've been working on those programs?
And this has just been a really amazing process to be able to bring these services, especially to rural communities, that I'm able to just be able to go. And I want to give a shout out to our Head Start programs that we partner with. Lindsey and I and other staff members were able to go in to do individual and classroom observations in Head Starts that we're partnering with. And then we're able to serve families from those referrals. We work with Northwest and Southwest Head Start. And they have been wonderful.
Since we've started working with the Head Starts, we've really seen the need for these types of services at these Head Starts. Because, we've had nonstop parents and staff kind of coming to us, and they've been great. Like she said, with our partnership with them, we're able to kind of lean on each other to make sure that these parents and these families and these kids get the services that they need.
Right.
And They give us a space usually to come in and work with them. The parents are able to come there to the Head Start, and so it's close by, and we're able to work with them, right there, and just give them this wraparound service just to make it as accessible as possible. And like she was saying, like we've seen a huge number, more than we could have imagined, that are really like benefiting from this type of service.
If I could ask y'all, you're saying you're in Head Start, you're talking to parents, you're doing assessments. We work with perinatal folks in the hospitals. What are the issues that you're seeing come up so much that really people need help for? And then we can talk about what the programs are that y'all are doing to help with them. What are the things you're seeing with these parents and kids? What are the behaviors or the issues that y'all are seeing that now with these services we're able to help with?
A lot of the ones we're seeing with this age, really like with the 2 to 7-year-olds, we see a lot of, especially in the Head Start, a lot of just dysregulation. Some of them may have had some traumatic events happen that have caused it.
When you say dysregulation to the lay person,
that's where I was about to specify. So dysregulation is kind of like when these kids their emotions are heightened. There's tantrums, and I'm talking not just typical 3-year-old tantrums. All 3-year-olds have tantrums sometimes, and we're not talking about that. But these are more daily tantrums or daily disruptive behaviors that really just cause a really big disturbance, and it just seems a little bit more than the typical 2 or 3-year-old. We see a lot of hyperactivity, of course, and not being able to stay focused and keep their focus. We see some with aggression. There's some aggressive tendencies maybe in some that have some bullying type behaviors, and a lot of impulse control. So those are a lot of the things we see in Head Start.
And then Kim, I know you work too with mothers of newborns and that kind of thing. What are some of the things
and this
you see
is
there?
it really it's about relationship. It's about, and of course, what I'm focusing on is that attachment, maternal infant attachment, and a lot of moms that you'll see. The problem is not with that, but it is you've had a newborn baby and maybe there's a 2 and 3-year-old in the home. And so you're bringing home this new baby, and then so you'll see those behaviors of the 2 or 3-year-old that start to emerge that are challenges. And so we're able to work with really young children, and that's why I really love this program. It's working with the parent in the room. So it's not like play therapy, if anybody's experienced play therapy, where child goes in the room with the therapist. This type of therapy, I always have parent in the room because I'm working with really small children up to the age of 5 or 6. So we're building that attachment, and it's really family therapy is what we're doing.
I've had friends who have had some of their kids see play therapists before, and I know that y'all do a lot of that and use a lot of those techniques, and they'll say, my kid loves their play therapist, and they act way differently with y'all's play therapist than they do with me, which is one of the things I loved about this stuff. Is really it's teaching parents how to do the stuff so that it crosses from the
how to navigate it at home.
Absolutely.
Right, keeping the parents involved really allows you to give the kid a natural environment that they're used to, so you can work on those behaviors and issues that they're typically seeing.
And that's what PCIT is. It's parent-child interactive therapy.
Right.
It is coaching the parent to play with their child. And it's not just play. And a lot of parents think, oh, this is just play. It is incredibly powerful. We've seen some very, very challenging behaviors shift quickly. And it's amazing to watch parents interact with their children. And some parents, what's really powerful is some parents are playing for the first time, and they're playing with their children. And there's other components to these therapies, and it is looking at generational trauma also. There can be some triggering moments that come up in the play for the parent. And so we kind of back up and we'll talk about those things and kind of process those things. And so there's a lot of healing that you're seeing through the play and through that relationship, and especially with child parent psychotherapy, you look at those, and we call them the ghosts and the angels in the nursery. And so it's those ghosts in the nursery, that trauma, that darkness that's there, and then the angels, it's that benevolence. It's connecting to maybe a smell that you had of, a grandmother that would, in her kitchen, or it's a beautiful process of healing for the whole family.
Right. And I feel like mentally dealing with the traumas that you maybe didn't even know you had, or haven't been able to deal with on your own, because you as just a regular day-to-day person is not a licensed clinician. They didn't study mental health. So having someone to go to, because that was my big thing, is that, I could talk to my mom, but there were some things that my mom's she's not capable of. She would get upset because, that
Sure.
person, you're attached to that person, you have feelings, and this person doesn't feel like maybe they can come to you and not be judged. But this is a way for people to meet with someone who is a third party. This person has the knowledge to empower you to make those changes. So that's amazing.
I think too
that it's the adults that get it as well.
Yeah.
Within those sessions.
And it's been these kinds of programs. I was glad you asked us for Mental Health Awareness Month, because these kinds of programs, I think even now people talk more about mental health, but mental health is still kind of automatically thought of as, severe depression or anxiety or panic attacks or schizophrenia. And it is all of those things. But these two are trained in, when you are exhausted, you get home from work, your kids are exhausted, they get home from school, stuff happens. And so this is not, mental health covers not just severe depression, severe anxiety, but everybody gets home at the end of the day, and now you have a million other things to do. You're trying to figure out how to interact with each other, get food on the table, get homework done, keep fights from happening, get rooms clean and laundry and all that stuff. That's mental health too. And so that's part of what they're able to do, is say, hey, how can we carve out certain time here and there? How can you?
Right. These programs are a way to help empower parents with the tools that they need,
Absolutely.
In those moments.
And it's not for people who can't do it on their own. That's not it at all. It's like, this is a whole new host of things.
Your bucket is full, and
yeah.
But you still have to take care of some things. Yeah.
And of course, Donald and Lindsey and I all have masters in social work. So we're going to look at this from a systems approach, that's our training that we've had. And so we're looking at the systems that affect families, and we have case management services that we can add on top of the therapy to help with housing, to help with to be a liaison within the school system, to check in and talk with the teachers. So we're working on the behavior at home with parents, and then case management's we're able to go into those Head Starts, into the elementary school, and just work with the teacher where everybody's on the same page, and just make sure that we're supporting families. And like I said, what I do is family therapy. And so we'll just have sessions with parents that just want to talk. I mean, they just need to vent. They just need to talk about life stressors. And so we'll do sessions that the child's not included, and they just need to talk about some of their history that pops up. If we want to add on other therapy for them, or if they just want to just keep it with that family therapy. So there's a lot of different ways that we can go with that, but it's just the basis of attachment. And it just goes back to, it's just kind of beautiful to see that fundamental behavior and how that just takes shape, and how it can be healed through play, which is amazing.
Yeah. Right.
And it's great that we're working with them while they're so young too, because once they start getting older, sometimes it's harder to get out of, change our ways of thinking or heal in certain ways. So working with these kids so young, it's really helping them shape their future. It's shaping their future for the best. And especially with the Head Start, we're really it's really great that we're able to work with them and get them ready for going into school, the following years. And
it's a multi-dimensional approach And yeah, especially for kids, you're giving them the tools as a child to deal with things as they come up.
I mean, part of what's so exciting about these models is, I mean, we've kind of described the two ends, the two sides of the continuum of their usefulness. Some folks have families have a history of trauma. They've got financial stressors, housing stressors, work stressors, neighborhood stressors.
And these are things that are never going to go away. You're always...
That's right.
There's never going to be a perfect time when nothing's wrong and everything's
Sure.
fine. So it's always something that's going to be
And
part
for
of your
some
life.
folks, there's a ton of those things. And this stuff, these approaches are helpful for them. And we can add those wraparound services Kim was talking about. For other folks, I've got friends that as I talk to them about some of what we're doing, they're not really bothered a lot right now by financial stressors. There's not a lot going on in family, but you know what? My first child kind of behaved this way at this age. This child's behaving in ways I just don't know what to do. And so it's not a disaster. People don't need all these wraparound services, but they can come in for some sessions and learn a few things that then they could teach the class. It's just stuff they've never known, never been shown. And part of these models enables them to learn that stuff and then take it back. So it can be major crisis going on. This stuff's helpful. Or it can be, you know what? Sally is a lot different than Joey. And I just don't know the stuff that I've done that worked with Joey is not working with Sally. Help me figure out what to do.
And you can go, you have a place to go to kind of figure out what to do about that situation.
And the type of toys are really important too. And it's in those early years, and I got to plug my former professor here, going back to Erickson's stages of development. It's that autonomy and it's that initiative. And, you hear that in school and it's like, and it is when you see that beautiful autonomy and that initiative. And that's what we're trying to develop, where they feel that sense of power. I can do it. And when you see it in this child that is really struggling and getting all this negative attention, and when you shift it and you give that positive attention in there and you see them just take a breath and they're co-regulating with their parent, and you look at the parent and you go, did you see that? Did you feel that? And they're feeling that and they're sensing that shift in their child. It's a beautiful thing. And you want the child to be the hero of their story. You want them to do that. And when you're playing with superheroes and you're playing with these little characters and that takes shape and they're making that happen. So it's very specific in the type of play that we use, and it's the type of toys that we use. We want to use things that are non-competitive. We want to use things that you have a little skill there because you want some frustration. Maybe they're building a tower and it fell down. And so parent and child are able to co-regulate of it fell down, but you're going to build up and it's going to fall sometimes. And that's just kind of the basis of life there.
Right. So if somebody says, well, that sounds great, but I mean, really, my kid is hitting their siblings, punching the wall, spitting on the teacher, biting the classmate. Why should I bring them to you for you to play? Everything you're saying sounds great, but it sounds kind of mushy. What would you say to that based on?
With this, I would say to that, it's the data really shows with PCIT, we have the research to show that it works, and we've seen that it works.
So what's different about play when you're playing with kids, teaching parents how to play with kids? What's different about how y'all are doing that makes it therapeutic and does have all these changes that are seen in the data and seen in the office for kids? What's different about when parents think they're playing with a kid and what y'all are doing?
It's very specific. It's very specific with the type of toys that we use. You really need to make sure that you're building that relationship component first. When you build the relationship component and you shift the negative to the positive, and the child starts to be flooded with all of this praise, all of this attention, when they're building something, when they're doing something positive. It's amazing. It just in the first portion of that, you'll start to see when we do the scores, we use the Iberg score to track it, and you're starting to see those numbers start to come down.
What are those? What do you mean? What's that scale tracking?
It's tracking negative behaviors and how that's affecting the home. So we're able to graph that. We're able to track how well that the child is responding to the interactions. And it's really simple because our goal is 5 minutes of play a day, and that's it.
Why does that sound like nothing but must be huge?
It's incredibly intense. It's an incredibly intense interaction between parent and child.
It's very focused.
Very focused.
I'd like to explain what PCIT really looks like, this parent-child interaction therapy. Kim did a great job at explaining how that really affects the relationship and the bond and everything. But what parent-child interaction therapy does, it enhances that parent-child relationship, and it can improve the child's behaviors that we were talking about. And it really helps empower parents to use effective and consistent strategies to help with these behaviors that they're seeing in their kids. And what it does, like you said, you asked, it just looks like play a lot. Why would that help with these, just extreme behaviors? But really, it's done in 2 phases. That first phase is child-directed interaction, so it's CDI, and it does feel like you're just playing with your child. Like she said, it's very specific type of play where we kind of teach the parents 5 basic play therapy skills that we want them to use during this play with their child. And those skills are what make it a lot different from just regular everyday play. So those skills, like she said, the types of toys they use, we want specific types. And then we want these skills, the parents to just hone in on them and really get to where they can just say them and they get used to them using them all the time. So that first phase, it's really for helping the caregiver and the child bond over this play. And then they'll practice these skills. And then using, like she said, 5 minutes a day at home, we just want the parent and the child to practice these skills. Once we get to a certain score, she was talking about those scoring sheets, once we get to a certain score and the parent gets to a certain level of being able to use these skills, that's when we move into the second phase. And that second phase is where we really hone in on those behaviors. So the second phase is parent-directed interaction. So that's PDI, and that's where we'll start adding in, during the play, we'll start adding in some basic, we may add in some basic commands from the parent. We'll have the parent leading the play, and it gives the child a chance to follow the lead of the parent or not.
Right.
And when they don't, that's when we kind of, on this play level, start to try to make those changes and, have the child see that, we have to do what our parent says and we have to follow these rules, and there are rules and we can't just do anything we want all the time. And that's when we really, like I said, hone in on those negative behaviors. And that's when we start seeing a lot of change in those behaviors. And we will see a decrease in a lot of the behaviors in just that first phase, just because of that relationship building. But we really go hard with it on that second phase. And that's when, I think that's the part that most of the parents are waiting for. They're like, why can't we just do that first? But that first part is so important.
And it's a process, too.
It's a process. It's not immediate. And, I always try to let the parents know that, it's going to feel like this. It's going to feel like play, but it's so important. A lot of the parents usually end up really enjoying that play, too, because it's just a great time they spend together. These skills we use help the kids stay connected and involved, and they don't, it helps their attention span using these skills, so they're able to just have really good, peaceful playtime with their kids that they're not used to, sometimes not used to having.
And a lot of with children, they'll play alone. And so the goal is really to use the toys as a bridge for the relationship. So the goal is where you might see a child that they want to take the toys and that go in the floor and just kind of play away, pull them back to that interactive play with the parent and build that relationship with the toys.
You're playing and letting the kid lead it. And I guess the attention and interaction of a parent to a kid in that first part is magical to a kid, really. I know for parents, it's difficult again after a day of everything parents are managing. You get home and you're trying to do all this other stuff.
Right.
I can see how for a kid, 5 minutes of, holy moly, my parent is completely playing with, I have their full attention. I don't have to do anything or get in any trouble to get it. I've just got it. And then once they realize how valuable that is, I guess you're able to, it's like the stakes are lower if you're playing and you have to correct behaviors. The stakes are lower, and so parents learn how to do it in that context, and then that carries out in other places. Is that right?
Right. It absolutely does. And then once the parent is used to those skills that we want them to practice too, the reason we want the parent to know these skills and get really good at them before we move to that second phase is because they use those skills to give these commands and do these things to get the child to follow.
Is there a set number of time that it takes?
Really, typically, on average, it's about
8 to 12 weeks, I think.
It's roughly...
Of course, it's different for everybody, I'm sure.
Yeah, it is different for everybody. Roughly, it's about 8 to 12 weeks. And usually the first phase is between 4 to 5 sessions. And then it can be longer or shorter for everybody. And then we go into that second phase. And it is a weekly process because it would take much longer if we're not meeting weekly. Because when they come into the office, they are able to show us how they've been practicing, and then we're able to kind of go over and help them work on the skills that, maybe they're falling short on a couple of places, and we're able to coach and help them, and then they go home and practice and come back. So
something that I was fascinated by in the data around parent-child interaction therapy is obviously the goal is 12 weeks, and they've already kind of mentioned it, the data shows that results are within the first 4 to 5. So some, all models of intervention are going to work for X percentage of folks. Part of what makes this approach stand out among other models is even if it's not finished, even if you don't have the perfect set of appointments and numbers and all that, and you've gone all the way through the official steps and sessions, there is major progress. And for families who are trying to do life, any kind of progress is major. It's huge.
So let me bring it back to you guys. For yourselves in these programs that you've been working on, what has it meant to you to see the progress of the people that you've worked with? What does it mean to you as clinicians?
For me, I want more families to have this service. I mean, we've just seen it work, and it just comes down to that fundamental, it's about relationship. It is building these relationships, these skills that are going to be lifelong, just fundamental skills that children can take from here on out. And it really, really works because you're keying everything in on those specific developmental stages and using the language that's needed at that time.
Yeah, it's been really amazing. We've seen so much progress in such a short amount of time when we first start working with some families. And there's been we've seen it firsthand right in front of our eyes in one session, the changes that can be made. And, sometimes we have a client, a kiddo that we're worried, like, they may be having a meltdown, and we're like, oh my goodness, like, what if this doesn't work? And we see it right then. We're proved that, like, it works. It's proven to work and it helps. And it's so exciting when we see that. And when the parent's able to see that and see their progress as well as their kids' progress, it's huge, and it gives me chills.
Having that awareness, having that information that you didn't know was available to you, using it and seeing it through, that's an amazing thing.
I would think parents, it must be that same feeling. It's like this, I do not think this is going to work.
Right.
And then you try it, and then parents too are like, whoa.
We've seen that just with, some parents have said, you're never going to get my kid to sit for 5 minutes and play with this one set of toys just with you, and they're blown away that just by using these skills that you can keep a child's attention just using these skills. And that's why we use these skills. A lot of parents have been blown away just at that, just how well that you're able to kind of keep them focused and sitting and playing for 5 minutes.
This is up for anybody, but is there a myth or is there a stigma that you guys see a lot or have a lot of people coming to you with that you want to dispel and kind of help people understand about mental health awareness, seeing a therapist, seeing a counselor?
Yeah, thanks for that. I couldn't have paid you money to ask a question we would more like to answer. That's why when we had talked to you all about doing something for Mental Health Awareness Month. This felt like an obvious answer, this specific thing going on, because mental health is depression, it is bipolar disorder and schizophrenia. It's also just how do we do life well with the people in our homes. Therapists aren't magic. Clinicians aren't magic. There are things that we've been trained to watch for and see. And as a good social worker, your goal is to not be needed anymore. And so part of what our goal is not to be the keeper of all these secrets, so that when your child's here or when you as a couple are here with us, y'all talk better to each other, or you figure out what's going on and make progress, or your kids start making progress and acting in ways they're proud of, just like the parents are. We want to work ourselves out of the picture. And so I think a big thing for people to think about is mental health is not just these major crises, these major diagnoses. It's I ask my doctor for some basic ideas of how to get my blood pressure down, how to handle my weight, what to do about my sleep. The same is true on the mental health side. If everybody had a 6-month checkup or a well child visit with a therapist, or a well adult visit with a therapist once or twice a year, I think that goes a long way. And so, yeah, all of that together really being mental health services are not services for people that just can't do it on their own. It's just a whole set of resources and skills and tools for everybody that makes everybody's interactions with each other, whether you don't have kids, it's you and folks at work, or it's you and your family, or you and stuff you've been through in the past. Mental health is learning how to operate in those ways with healthy skills and tricks and tips. So yeah, it's for everybody. And even just a few visits are going to make a difference. We don't if you call us and come by, you're not signing up for the rest of your life to be in counseling. If you want to be, fine. I think that'd be great for everybody. But it may just be, you know what? I need to talk this stuff out. I need to learn about a few things that are going to feel like I've always known them once I've heard them, but I don't know about them right now. And then go on your way. And when something else comes up and you need us, call us back. So
I'd like to add on to that real quick, with specifically to this PCIT, this parent-child interaction therapy. Just because a parent is having a hard time currently with, some of their child's negative behaviors and things like that, just reaching out for help and stuff, I think a lot of times that can make parents feel like they're bad parents or something, and that is never, ever the case. I think all the parents we work with are amazing and awesome, and that's not at all what that means or looks like. It's sometimes, like Donald had mentioned earlier, that sometimes, either we have a lot going on, and sometimes, we just don't know how to give the right attention sometimes. And then sometimes it's just what works, what he said, what works with Sally's not working with Joe. And they need a new way to understand of how to interact with this type of behaviors. And so it's never ever the case that we have, it's a case of a bad parent. That's never the case. And that's never how we would ever want anyone to feel when they come and work with us and we're working in therapy with them.
Right. Just like Donald said, if you're having problems with your blood pressure or some physical ailment, you go see a clinician. This is just a different side of medicine and the clinical area. If you're having problems mentally, just dealing with something, that you have these resources. If someone was interested in these programs here with Pathways and with Psychiatry and Counseling, how would they get involved and how would they reach out to you guys?
Yeah, well, I'll give you the number again, and then I hope you'll
and
put
we'll
it in
put these. Yes, we will put these in the podcast show notes.
So the 731-265-6450. If people want to call that number and say, I want to know more about PCIT, then we'll have the right person get back to you. It's good for folks to know we've got the most offices here in Jackson and in Madison County, but we are all over West Tennessee, and they're offering this in our Union City office, the Dyersburg office, again, even in some of these community spots. But what we've done for this in particular is, if you're a parent and you don't know if this is right or if there's something else that would be better, but you just want to say, here's what's going on, what should I do? Call that number and know that we can get you connected to Kim and Lindsey and some of we've got a ton of therapists who are offering this in all of these areas. We can get you connected, but that one phone call can kind of help.
Right. We've got the resources to help you.
That's right. And one other thing I do want to make sure to say is people are often nervous. Everybody's nervous about if I show up to any kind of doctor or any kind of medical service, what's it going to cost? Is it going to be something that sounds great and then I can't afford that or my insurance doesn't cover that? I can't promise you that it's going to be free, but I can say that as a policy with Pathways, we are going to make sure that the cost of something doesn't prohibit you from getting the services and the care you need. A huge shout out to the Tennessee Department of Mental Health, Substance Abuse Services. Commissioner Williams is the best. We get grant funds from them that help cover this. Did you know that through the state, even if you have commercial insurance, but it doesn't offer the behavioral health coverage for your kids, the state's got you covered. We can get you signed up for some of that stuff. So don't let cost be a concern. Don't let where you live be a concern. And don't let, is this what I'm asking for, or do I really need something else to be a concern? Just call that number and say, I'm a parent, I guess the kid's not going to call. I'm a 5-year-old. Call and say, I've got a 5-year-old, or I've got a teenager, or my spouse and I are dealing with this, or I'm going through that at work. Call that number, tell us what's going on, and we'll do the legwork to get you to the right people for the right stuff in the right place in a way that the cost isn't going to keep that from happening.
Great. Well, thank you guys so much for being here and for sharing all this great information for mental health awareness and what we've got going on here in West Tennessee and all the resources that are available to us.
Great. Thanks for having us. Awesome.
Thank you guys so much.
Thank you for having us.
Thank you for listening to We Talk Health. This podcast is not intended to replace any medical advice. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions or would like to request a topic, you can reach out to us at wetalkhealthpodcast@gmail.com.